Notice I took the mask off, right? Happy Friday, Baylor College of Medicine. It's been a pretty good week this week. First thing I want to tell you is my brother-in-law has been complaining. He says it's that the videos are too long and not funny enough. And that's probably true. So I'm sorry, Sam, but they're going to stay that way. First thing I want to do is give you a little bit of a teaser. I am going to reveal the famous Klotman Plan towards the end that will figure out how we can all get back to school and start doing things normally again. I feel a little bit like I watch so many newscasters and so many experts and authoritative statements, but no one's really talking about how do we get where we need to go. So I thought it'd be worthwhile for us to think about ways to accomplish that. The first thing I want to do, though, is talk about some of the data from the Texas Medical Center, because it's looking promising. The first thing is that the number of cases that we have is beginning to drop. And so we've gone over the peak, we're beginning to come down, but we're still at a case rate that's 1,700, and just a few months ago we were talking about 200 cases. So we're way beyond where we need to be to really expand the economy or go back to school. The second thing is our hospitalizations are going down, and that's very, very positive. So we're not having any problem right now around capacity. We've had some stress on ECMO devices, which are the way we oxygenate blood if the lungs are too damaged. We don't have a lot of those machines, and that's our only real stress point. But by and large, we're doing very, very well on the hospital capacity and the ICU capacities. And the other good news is that the testing is continuing to expand, and our testing percentage positive is beginning to go down again. We were as high as 22, 23% last week, and now we're down more towards 16 or 17%. So those are all good things, and we should all be happy about that, but that's not good enough. That is just not good enough. And the biggest problem, I think, has been really we are focused on mostly the wrong numbers. And we have been locked into hospitalizations and ICU capacity. Every time I turn on the TV, there is a reporter standing in front of a hospital reporting on the percentage occupancy of the ICU, like 85%, 95%. This is nice, or it's important information, but that's not what we should be focused on. And I understand why. In Lombardy, Italy, they were stressed, they were overrun, the ICUs were filled to capacity, and people were dying as a result. And the same thing happened in New York City. New York City was over capacity. They ran out of beds and ventilators and PPE. And as a result, all of the focus has been on those parameters. How much PPE, hospital capacity, ICU capacity. But that is just not the right focus. It's hard to come up with the right analogy, but imagine thinking about traffic, and we're reporting on how many roads we have instead of how many cars are on the roads. Now, you could understand why you would do that in a traffic jam initially, but right now we got to start thinking about the cars entering the roadway, not how many roads we got. And so the way to do that really is following the right parameters. So the single most important number is the number of new cases. The number of new cases is really critical because that is the number we have to get to where we can go from a mitigation strategy back to containment. And that number's got to be low enough that we can actually get quick testing, identify the patient, contact trace, and isolate those patients. All that has to happen, and that can't happen unless the number is probably closer to 150. That's really, really important for us to actually do what we want to do. The second most important number really is the R number, and that's got to be something that we start focusing on rather than the other kinds of numbers we're talking about. Now, it's not all that easy to figure out what that is, so I want to show you. The actual formula is important to know. So the R0 or R0 that people talk about is the number of people I would infect, I'm the single case, I would infect in a totally susceptible population. And flu is in the 1 to 2 range, measles is in the 12 range, and in this case, in COVID-19, it's between 2 and 3, probably closer to 2.7. But the number we really want to follow is what the effective R number is. And that is very much dependent upon the number of contacts that I would come in contact to if I were the index case, the number of infections I would create by coming in contact with people, the length of time that I'm infectious and out there being, contacting other people, and then the total population susceptibility. So each of these parameters is actually affected by a number of different issues. That number that we're trying to get has got to be below 1. Below 1 means we're winning. Above 1 means the virus is winning. So if you think about the number of contacts I can have if I'm infected, things like the policy of locking down, closing businesses, closing church events and gatherings, working from home, those all impact the number of cases I might come in contact with. The infections per contact, the number of people I can actually infect if I am COVID positive, that's influenced by hygiene, washing your hands, PPE, and most importantly, wearing masks. So the more masks that people are wearing, the less likely you are to actually transmit the infection. The infectious period really is contact tracing. So how long am I out there infecting a bunch of people? So it's got to be timely return of tests. It's got to be contact tracing, isolation, and treatment. And then the population susceptibility is something we can't really deal with without a vaccination. So vaccines change the population, and that's herd immunity as well. What's the prevalence of the disease? And one of the reasons I keep pushing we need to have a prevalence number is because it helps understand the population susceptibility. Now, the interesting thing about it is if you can significantly reduce any one of those variables, you will dramatically reduce the R value. So as we saw, locking down the community significantly reduces the R number. The trouble is, what do we do when we reopen the community? And that has been a real problem. The second thing is masks. Masks really work. Well, just think about this. If we could reduce by 2/3 the amount of infections we create between people by wearing masks, you reduce our number from 2.7 to 0.9. So going from 2.7 to 0.9 is below 1. Just by the use of masks, we can begin to totally reduce the total number of infections in the community. And I remind you, we talked about Spanish flu. Spanish flu was brought to its knees and disappeared simply through public health measures, distancing, and wearing masks. And then again, when we get a vaccination that's successful, we'll be able to really influence it tremendously. So in general, the most important thing is we have to have that R number below 1 before we're really in a position to start expanding businesses and doing the kinds of things we want to do in schools. The third indicator, which is less good but we use a lot, is the percentage of tests that are positive. That a lot depends on how many people we're testing and how many people are significantly, are either symptomatic or asymptomatic. When we achieve those things, when we get to those 3 parameters that are less than 1, under 150 cases a day, less than 5% positive tests, we will be in a great position to begin to expand businesses. But how do we get there? That's the big thing. How do we get from where we are to there? Now, there's a big debate out there in the community. We should go to a 2-week lockdown. I do not think that is the right way to go. And it's real simple. Where that has happened, I'll use Hong Kong and Australia as examples. Once the lockdown is over, they go back to having a lot of infections and you have a resurgence. The only way to bring this down is through behavioral change. So we have to get everybody to start behaving in a way that makes it possible to control this virus, and that is social distancing and wearing masks. Now, I personally believe that the business community can do a lot more than they're doing. Bars clearly need to stay closed. The restaurants, indoor dining, that shouldn't be 50%. We need to probably go back to 25% capacity and start enforcing occupancy rules. The other thing the city could do is close streets, allow restaurants to move out into the sidewalks and on streets to expand their ability to do outdoor dining. New York City has done this very effectively. There's no reason why Houston can't start looking more like New York and the rest of Europe by having much more dining that takes place outside. The retail sector of business, I think, has done a really great job. Businesses, I'll use Home Depot as an example. They have had their employees all wear masks. They do not allow customers in unless they're wearing a mask. They have ambassadors to go around to make sure everybody's wearing a mask. They deserve a lot of credit, and retail sector of our business community, I think, is doing a much better job than many others. The manufacturing community has to step up and start policing itself as well. And transportation is just really, really hard. I applaud Delta Airlines. They've taken it very seriously. They've embedded social distancing by keeping middle seats empty. Southwest was doing that for a while. Some of the other airlines, not so much. And I think this has really got to be taken seriously before we really can achieve what we need to achieve. So, what's the Klotman Plan? Let's say we hit those 3 targets. How do we really open up schools? Well, I think the right way to do it is you have kids in classrooms become their own individual bubbles, just like they're doing with Premier League in soccer in Europe. They stay together, they move together. It's always one group. Each Monday, we get a pooled saliva sample. So you get all the kids, spin a bucket, we do a pooled sample to see if there's anybody positive or not on that Monday. Everyone wears masks and is 8 feet apart all the time, and teachers behind plexiglass and get tested weekly. There has to be special focus on when kids are on break. Indoor eating and breaks for not just students but teachers need to be policed. You need to remain socially distant. That's really, really important. And we really need to make sure that we're following these groups every week. If somebody turns positive, then that whole group is isolated, and we test for individuals to see what isolate that particular group. So I think these are the ways we can get back to teaching and having schools, indoor schools. But if we don't do that, if we don't have the level of safety that we need, I don't understand how we can even be talking about schools when we have 1,700 cases a day. Anyway, I think it's a real opportunity for us to focus. I think the business community and the faith community need to help us. We got to keep congregations down. We got to stop having large group spreading events. But if we do all these things, we can get to the point where we can begin to open schools with a plan. And so there is a plan. I think that plan will work and will keep people safe and keep teachers safe as well. So think about it. Have a great weekend as you think about all the stuff that's happening in our world. Thank God we missed the hurricane last week, and hopefully we will continue to have luck with the weather. Have a great weekend. I'm really, really grateful to everything our community is doing. Baylor, in particular, we're doing so much for the county and the city around testing and trying to give policies that make sense. Have a great weekend, and thank you so much for what you're doing. Thank you, Baylor, for everything you do for our community and for the country and the nation and the world. Thank you so much.